Hi everyone, I'm Dr. Kleist. I'm one of the surgeons from our Titletown Total Joint Replacement team, and I'm here to talk to you today about some specifics about total knee replacements. First off, why would someone even need a total knee replacement? Well, my patients would tell you, I always say this to them, it's really about three things. It's about pain, function, and quality of life. If you have bad arthritis and you've tried a number of conservative options like injections and medications and therapy and they haven't worked, and you're still having pain, problems with your function, and poor quality of life, that's when it's time to consider knee replacement. Now, there are advantages and disadvantages to having a total knee replacement. The obvious advantage is it's a more permanent solution to arthritis. And most people get a great result from it and can resume essentially normal activities. There are, of course, disadvantages to knee replacement. There's a lot more risk with surgery, and it's a big recovery. In general, we say you return to pretty much normal activities by 3 months, but it's really 1 year till you kind of reach that maximal level of improvement. So what you need to think about as you're considering surgery is, what are my expectations and what do I hope to get out of this? You should be really looking for an improvement. This isn't going to return your knee back to where it was when it was 20, but you should be much. You can do most activities, but we strongly encourage you to avoid high impact type activities. I also wanted to talk a little bit about kind of some do's and don'ts after surgery, especially in the early part after surgery. In the first 6 weeks, we're really focused on getting your range of motion back. And therapy is really your key to that. Not just going to the therapist, but also at home. You should be doing your exercises at least twice a day and going to the therapist about twice a week. And in that first 6 weeks, we'd really like you to see getting your motion all the way up to 120 degrees. Now, the don't part is you also don't want to overdo it. You don't want to overdo strength or walking distance early on after surgery, or you'll get a lot of swelling. Along with that, you want to think about, what can I do at home to reduce those problems, such as icing, elevating your leg up to the level of the heart, and making sure you're doing all your exercises regularly. Now, in the more long-term do's and don'ts, the biggest thing is to avoid high impact activities on your knee. Pretty much most other activities are allowable, including kneeling, as that's a question a lot of people have. So hopefully, as you start thinking about knee replacement, you'll realize that this is really about choosing the right time to have your knee done, putting in the work and time, and understanding some of the limitations and expectations.